Doctor, I think you can take it from here. Thank you.
Hi, everyone. I am Dr. Amodita. Thank you, Pastor and Noah Women, for giving me this opportunity to talk about such an important topic, which everybody shame or, not willing to talk about, because still in various parts of our countries, and especially even in metropolitan cities, most of the women don't want to talk about it. But now the things are changing as and when we are gaining more and more knowledge about it, and as and when people have started talking about it. So, but still, there are a lot of stigma and taboos associated with the menstruation and the menstrual cycle. So, first of all, I would like to, tell you about some quick facts about menstruation. That is, how important menstruation is and what exactly is menstruation. So, the most important thing is that menstruation is nothing but what happens is there's something called as a menstrual cycle and there is something called as a menstruation. So menstrual cycle is like our period cycle, also known as period cycle, where the process of ovulation, that is the egg release from the ovaries, happen, and then our uterus, when the egg is released from the ovary, our uterus prepare itself for the pregnancy, and when there is no pregnancy, the lining of the uterus starts shedding in the form of period blood. So this is what exactly the period blood is. And period blood is not dirty at all, but it shows that you are growing. It shows that you are fertile. It shows that you have the capability to carry one human being in you, and to for the development of that human being, that uterus is preparing itself, and when it doesn't happen, it is shedding its lining. So it's as pure as that your body is ready to give birth to somebody else. So I think rather than just demeaning it or concerning it, we should more talk about that, how important the periods are. The next important thing is that on a woman spends almost like 3500 days in periods, so that is almost like 10 years. So that is a big thing, right? And when we demean such a big part of women's life, there is no meaning to women's life. When you are menstruating, that means that you have a meaning to your life, right? So these things are very, very important. And to understand that what period is the basis of all the myths and the facts which goes around the periods. So coming to the myths, there are so many myths. Like if we start reading, there is no end to those myths. Like you can just you can go through on the internet and you will see that every page has like almost 50 to 60 myths associated with menstrual cycle. So now, starting on and going on to some of the period myths that we have most commonly heard about, and which most of the women go through since the beginning of their menstrual cycle, are like, suppose somebody's having their periods. So the first myth is that everybody listens to is period flow or the period blood is completely impure. So that's the most common myth that we go through. And because it is considered to be as impure, the girls are not allowed to enter into the temples. The girls are not allowed to enter into the kitchen, or they're not allowed to touch the plants, or they're not allowed to cook food or touch the things which, like, making of the pickle and all those things. Why? Because the period blood is considered as impure. But to know exactly what period blood is, as I've already told you, like how the menstruation happens is when the ovulation is happening, the uterus is preparing itself for the pregnancy to happen. And when the uterus is preparing itself, there is development of the lining inside the uterus, so that whatever embryo or the baby is getting about to form should come and sit in the uterus. Uterus is going to provide that shield. But when that doesn't happen, the thick lining which is formed because of in the speculation of pregnancy, that has to shed out, right? It cannot keep growing into it. So when it is shedding out, so that means it is coming in the form of blood. So the blood is absolutely the same which is coming out, just that it is associated, or along with that there is uterus lining, and along with that there are microorganisms which are flushing out. So that's the scientific basis of period. And you tell me that something which is as pure as giving birth to a baby, how can something be impure? That thing can be impure. So that's a complete myth. And we have, if somebody from next time onwards say that, period blood is impure, we need to tell them it is as pure as giving birth to a baby. That's how pure it is. And coming to like being impure, you're not allowed to enter the kitchen or do any other spiritual activity. We need to understand, when you're maintaining your hygiene properly, there's no harm in entering a kitchen or going to a spiritual temple. But why they used to say that you shouldn't go to a spiritual temple, according to, if we go back to our culture, and if we go back to our cultural beliefs, like why they used to say that you shouldn't enter a temple, the reason because was, when if we talk about the energies, so somebody who's menstruating is very high on energy, and somebody who's menstruating attract all kinds of energies, whether it is a positive energy or negative energy. And if somebody who is menstruating is going to go in the temple, so all the positive energy of that shrine is going to come into that menstruating women. So that was the reason why they used to say that a menstruating women shouldn't go to the temple, rather than actually because they used to consider women as impure. So that if we go by that speculation, so that makes a little sense that, okay, why we are not allowed to go in the temples. But still, if we go by today's science, and if we go by because it is impure, we are not allowed, then that's complete bullshit, and we shouldn't go and listen to any of that. And just maintain your personal hygiene, and you're very well to enter into the kitchen or to the temples or any spiritual place for that matter. The next myth that is associated with the menstruation is that, when you are menstruating, you're not supposed to do any kind of exercise. So it's the biggest myth. Rather, we say that nowadays that there are a lot of studies which have been conducted, and they say that when you are menstruating and when you are exercising on menstruation, so exercise leads to the production of a good or a healthy endorphins, and those endorphins secrete happy hormones, and those endorphins also help in the secretion of antiprostaglandins, which help in relieving cramps. So those of you who have been suffering from dysmenorrhea or period pain, it's very important for you guys to exercise throughout your period cycle and also during the menstruation, because that will help in relieving your cramps rather than aggravating your condition. The only thing that is not advisable to do during the period cycle or the menstruation is to do inverting poses in yoga. Yeah, that is for sure. I would advise that you shouldn't do, because those inverted poses of yoga can cause, can aggravate the period pain, because that can lead to accumulation of the blood in the uterus, and that can lead to retrograde flow also. So it is advisable not to do those retrograde or the inverted poses of yoga during the menstruation. But otherwise, you can very well go ahead and do all sorts of exercises, whatever you are comfortable with, not doing vigorous exercises, but whatever you're comfortable in and whatever your body allows you to do. So those kind of exercises are very, very important, and they will improve your period, they will improve your mood, they will improve your flow, they'll improve your period cramps, everything will get better. So that exercising in period is not advisable is again completely a myth and shouldn't be followed at all. Then the next most important myth, which we come across, is that PMS is not real, or PMS is something which is in your mind, or somebody who is menstruating will be having mood changes, will be having anxiety, agitated, and you shouldn't talk to somebody who's menstruating. See, PMS, I would say, is something which is very, very real. PMS, or which is also called as premenstrual syndrome. Why it happens? Because, see, what happens in our body is when the menstrual cycle is completing itself, like after the ovulation, the female hormones, estrogen and progesterone, they are fluctuating at a very high level. And those estrogen and progesterone are responsible for the secretion of happy hormone in our body, serotonin. So when there is, dip in the estrogen and progesterone just before the period begin, at that particular time, serotonin, that is the happy hormone, goes down. So that's the reason why every woman who's about to get their periods undergoes some sort of mood changes or undergoes some kind of symptoms. I would like to tell you that there are, almost 120 different kind of symptoms that any woman can experience during the premenstrual phase of their life. It can range from bloating to nausea, vomiting, constipation, diarrhea, mood changes, anxiety, and depression, and precipitation of bipolar disorder or schizophrenic attacks, or ranging from skin changes, that is skin looking dry or skin looking extensively oily, acne before the periods, or hair fall, or white discharge. All these things, they're part of those 120 different kind of symptoms which anybody can experience during this time. And it's all because of the estrogen and progesterone, which are fluctuating at such high and rapid rate, that is causing all these symptoms. And every woman will experience at least one of these symptoms during their lifetime. There is something called as PMDD, which is more severe form of PMS. So most of the times, most women, they tolerate and they go through this PMS. But when they enter into the phase of PMDD, which is like a severe form of PMS, that's when, it starts affecting their life. They are unable to do their work. They are unable to enter into the hospital, or they're unable to go to their office, do their day-to-day activity. It is affecting them physically, mentally, emotionally, everything. And this PMDD now is coming up so well because people are talking about it, and we have found a complete cure to it. So if any one of you is suffering from PMS or PMDD, then you should definitely reach out to a gynecologist and talk about it, because the more we talk about it, the more we'll be able to find answers to all our queries. So definitely PMS is something which is very, very real, and we should appreciate, and we should talk about it, and we should not negate it. And somebody who's negating it and telling you, oh, this is that time of the cycle when you are not doing well, or when you are upset, you're always upset during that time, please put a stop to all that nonsense. And because PMS is very, very real, it's all the hormonal imbalance and disturbances which is happening in your body. So you need to appreciate it, you need to understand it, you need to correlate with your period cycle and understand that this is actually what is real, and it is scientific. It is not something which we are making up, or it is not something which is, we are just for the sake of saying we are saying it. So that's about PMS. Now, next common myth that we come across is that if you miss your period, then you're pregnant. So this is also a very common myth, because people don't understand that missing period doesn't only mean that you're pregnant. That's one of the diagnoses. But if you're missing your periods, then, and if you're not pregnant, then what it is? It could be because of the hormonal imbalance which is happening in your body, and that hormonal imbalance could be because of thyroid abnormalities, could be because of PCOS, which is causing those hormonal imbalance and causing you to, delayed ovulation, and because of that you're not getting periods. Or it could be because of the rise in the stress hormone. So if you're under stress, then that can lead to delay in your periods. Or if you're exercising too much, or if you're not exercising at all, or if you are eating too much, or if you're not eating at all. So in any of the extreme situations, the hormonal balance in the body gets affected, because the axis, the hypothalamo-pituitary, the brain and the reproductive system axis is so sensitive to any kind of change in the body, that it's gonna affect your hormones to next level, and you are going to have delay in the periods. So if you're missing periods, it doesn't only mean that you're pregnant. If you're missing periods on regular basis, you need to get evaluated. You need to talk to your gynecologist, talk to her, get evaluated, share your symptoms, know what's happening in your body, and whatever hormonal imbalance is happening in your body, that can be corrected at that particular time. So this is also a complete myth, that if you're missing your period, you're pregnant, because that really doesn't mean that. Then next most common myths that we come across is that use of tampons can lead to loss of virginity. So let me tell you that what do you mean by loss of virginity? Loss of virginity means when you are having an intercourse and you're losing a virginity. It's not by if you're putting a tampon, you're going to lose virginity. It's not that. And even when anybody who's unmarried and anybody who wants to use tampon, they can use it, because the tampon is just gonna stretch the hymen, and hymen is such an elastic structure that it's gonna get stretched and then it's gonna come back to its original place when the tampon is removed. So if you think that by using tampon you're gonna lose your virginity, that's a complete incorrect and a nonsense thing, because hymen is such an elastic thing. As soon as you remove your tampon, it's going to come back to its original shape. So anybody who is not married or who's not sexually active can definitely use tampons and menstrual cup. There is no disadvantage, or nothing is going to go wrong. We need to understand that hymen is elastic. It is going to expand as when we put the menstrual cup, or when we put the tampon. And as we remove it, it's going to come back to its original shape, and you're not going to lose the virginity just by the insertion of the tampon or the menstrual cup. Then next this thing myth that we come across most often is that if you have irregular periods, then that means you're infertile. So that's complete nonsense, because again, irregular periods definitely mean that there is some kind of hormonal imbalance which is happening in your body. But any kind of imbalance which is happening in your body can be corrected, and it will never lead on to infertility. Definitely, if you're not controlling that hormonal imbalance, and if you're not getting it evaluated, and you're not getting treated for that irregular cycle, then in long run, you might become infertile. But if you are having irregular cycles, doesn't automatically mean that you're infertile. So we need to identify the cause of irregular periods, rectify it, and if it is rectified in time, then you will not have any kind of infertility at all. Then the next thing that we come across very frequently is that if you have painful periods, then also you're infertile. So that's also a complete myth, because most of 80% of the women, they suffer from painful periods, and that is just because when the uterus lining is coming out, the uterus is contracting very hard to shed it away, to push it away. So that's why you are experiencing that period pain. But when it doesn't mean that you are infertile, but there are various reasons which are causing painful periods and can lead to infertility as well. So if you have the basis of this is that if you have painful periods which is affecting you physically, mentally, emotionally, and which is preventing you from doing your day-to-day activities, then in that circumstance, you need to get evaluated once by a gynecologist, so that you know that nothing is wrong and this is just a physiological period pain. That's a normal period pain which happens to almost everybody. But by getting an ultrasound, we can know that these period pains are physiological, or they are due to some underlying disorder. And when we know that the basic is correct, that there is no underlying disorder and it's just physiological, then nothing is going to go wrong, and you will be fertile and there will be no issues later on in life. But once you have got yourself evaluated, we know about it. And if there is something, then that can be corrected on time, and that will prevent the infertility in future. So that's another cause, and that's another myth that we need to understand, and not negate that, saying that just because I have dysmenorrhea or just because I have painful periods, I'm not gonna conceive. Okay, so the next common myth that we come across is during the periods you cannot have intercourse. So that was a myth that was very prevalent previously, and the reason behind was that they used to say that that can lead to infertility in males, that can lead to a lot of infections in the males or the females. But actually, period sex, that actually improves the period pains, because there are prostaglandins in the semen, and when you have intercourse during the periods, there is better lubrication, and that prostaglandins in the semen, they help in relieving period pain. So if if you have a lot of period pain, then having period sex is good. It should not, it is a myth that there can be infections, there can be a lot of problems to the male or the female. So I don't think we should even consider those things, because they doesn't mean anything about it. Then the next common myth, but I would say that's more of a fact, that if women who stay together, they get their periods in sync. That's actually true though, because if you would have observed that if you guys are living in a PG or if you're staying in a hostels, the all the girls who are staying together, they sync together and they had their periods all, one in line, like one will get, the next day another will get. So that's a beauty, because all the hormones in one female gets aligned with the hormonal balance of the other one, and with the hormonal balance of the another one, and that's how everyone, they sync together and then they breathe together. So that's something which is a fact, not a myth. So that's something that we should look into, and that's an important and a very important this thing to think about. Next thing is that I was reading about, very there are sacred myths which are associated in various countries. Like I was reading about, like in Philippines, there is something called as there's a myth where they say that you have to wash your face with the first menstrual blood, so that you look beautiful throughout the year. That's a very common myth in Philippines, and I don't think this makes any sense, and it doesn't have any basis for it, but it's a thing that they follow, and it's a thing that they do there. Then in Israel also, they have a myth that if you start having periods, then on the first day of period they start hitting you on your face, because they say when they hit you on the face on your first day of your periods, then your face will glow and it will become red and you'll become beautiful. So all these are the myths which have no basis, and you can read like ample of them. The internet is so full of them, but you need to understand the basis, and we need to talk about it more, so that more and more we talk about it, the more and more we'll discuss things, and more we'll know that all these things, they're just myth and nothing more than that. So I think that's about it, and that's about most of the common myths which we hear about and which we go through. Now, if you guys have any of the questions, then I'm happy to answer all of them.
Thank you, Doctor. The part that you ended with was kind of, I think it caught everyone's attention and definitely caught me off guard. The first question that we have received is from Udita Das. She is saying, hi, I've been using menstrual cup since 2 years, but recently I felt itchy while putting. It was amazing using menstrual cup, so I want to use it again. So what can she do?
Okay, so see, itching can be because of some kind of infection, maybe which is happening inside the vagina. So just get evaluated once, get yourself examined once, and if there's any infection, that can be treated, and then you can use the menstrual cup again. There's no problem at all.
Okay. Udita, if that does not answer your question, please, you can put up a follow-up question and I will take it from there. Saili is asking that she needs guidance on diet during period days. What should be eaten more? What should be avoided?
Okay, so what happens is when you are about to get your periods, or on your periods, you are mostly bloated. So we advise all the women that you should go on to something which is called as low salt diet, and try to eat more of green leafy vegetables, more of fruits, because definitely they will decrease the inflammation in the body, and you will be less bloated and you will be more comfortable. So low salt diet with more of green leafy vegetables and fruits.
Okay. So Manisha is asking, can you say something about scanty periods?
So scanty periods can be one of the indicator for PCOS or some kind of hormonal imbalance which is happening in the body. So if you have scanty periods, then please get your hormones checked, and you will know that what is happening in the body, and then that can be corrected and your periods will become normal.
Okay. Payal says that I am having problem of PCOD. Is there any cure for the same? I am fed up with hormonal cycle medicines. Is there any alternative?
See, PCOS, everybody needs to understand that PCOS is a lifestyle disorder. Okay, the birth control pills which we prescribe for PCOS is a part of the treatment and not the treatment. The only treatment for PCOS is lifestyle modifications. That is, you need to take care of your diet and you need to exercise regularly. And along with that, when the birth control pills or the anti-diabetic drugs are prescribed, they're going to add in conjunction, and you'll be treated as a whole. So it's not like that only one thing is going to treat you. Birth control pills are going to just take you from one cycle to another, and they are not the treatment at all. The basic treatment is to control your lifestyle, and you take care of your lifestyle on a whole. That is, you need to take care of your sleep, diet, exercise, your stress levels. Everything need to be controlled. Then only the PCOS can be cured.
Okay. In the meantime, while other people are asking questions, I mean, everyone, please, if you have any questions, make the most of it in this session itself. And while they are typing, I have a few questions of my own. Firstly, I'd like to understand
Yes.
what exactly is the difference between PCOS and PCOD?
Okay, so PCOD was a, ancient terminology which was used. Now the new terminology which is used is PCOS. The reason why we are using PCOD and PCOS separately was because initially PCOD was only considered to be a disorder of the ovaries. That is, there are multiple cysts in the ovaries, and because of that, the woman is having irregular periods and gaining weight and other more symptoms. But now, as we are digging deep into PCOS and reading more and more about it, now we know that PCOS is not only related to ovaries, but it is a multi-system disorder which is affecting every part of the body. Because the pathophysiology behind PCOS is insulin resistance and the hormonal imbalance which is happening, and it's affecting the complete body. That's why now we call it as a syndrome and not a disease.
Do you think the word syndrome is also there because it is something which cannot be cured completely and is something which increases and lessens as in when your lifestyle is fluctuating?
No, so syndrome, we use the term syndrome when it is affecting the multiple parts of the body. So, this is a myth that PCOS cannot be cured completely. It can be controlled with your lifestyle. If you
Okay.
have a good lifestyle, I've seen patients going from, enormous levels of hormonal imbalance to coming down to absolutely normal. So if you're persistent and if you're acting on your lifestyle, taking care of your diet, exercising regularly, and doing and taking all the necessary medications which are required at that particular time, we can definitely control and cure PCOS.
Okay. So in follow-up to the previous questions that Payal had about her being fed up with hormonal medicines for PCOD, she has also written that is it advisable to get cleaning of ovaries and inserting kapatti?
No, 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 no. It doesn't have any significance.
Okay.
It doesn't make any sense. Property is inserted inside the uterus. It has nothing to do with the PCOS. And there is nothing called as cleaning of ovaries. All these terminologies are absolutely wrong. PCOS is just a lifestyle disorder and nothing better than controlling your lifestyle. That's all.
Okay. Asha Raj is asking, is it safe to consume B body wise for PCOS?
Be body wise. What is that?
So I think these are the, there are a lot of gummy bears or there are like sachets of syrup that you can add in your water and drink. I think it is something on those lines.
Okay, but
These
I
are like
don't know about it.
supplements. These are like
So
supplements.
okay. So for PCOS, I will throw some light on that. So the supplements which are required for the control of PCOS are myoinositol, D-chiroinositol, and chromium, and also vitamin D supplementation. These are the few things which are important for the supplementation of treatment of PCOS, but they are just supplements which are to be taken along with the other medicines. They alone cannot do anything about it.
Okay. Akshata is asking that she bleeds only 3 days in her period cycle. Is it normal? And what exactly, or what is the ideal period cycle?
Okay, so let me tell you that the period cycle, ideal period cycle, that you should menstruate for a period of 2 to 5 days. And you can have a period cycle anywhere ranging from 21 days to 35 days. Having the ideal cycle of 28 days is very, very rare. And your period cycle ranging from 21 days to 35 days is absolutely normal, with the period days of almost like 2 to 7 days.
Okay, I think that also answers your question, Archana, because it was on similar lines. I'll move to Siley's question. She's asking, does period color define your uterus health? Sometimes period blood is dark red, sometimes normal red, and at the end of the period, it is almost dark brown. Is it normal or does it indicate anything?
It doesn't indicate anything. The only thing that it is suggests why these color changes are happening. So let me tell you, there is a process. So when the period blood is coming out of the uterus and of the vagina, so vagina has some, bacteria in it, right? Almost vagina has 150 different kind of bacteria which secretes lactic acid and which are responsible for maintaining the health of our vagina. So that lactic acid oxidizes the period blood when it is coming out. So when it is too much, when it is coming in a, when it is in the first day, we are in a first day of periods and the flow is too much, then it will come as bright red. And as soon as the amount of blood is getting decreased, so the time period from it to travel from the uterus to outside also increases. And that's when the oxidation of the blood increases, and that's why it becomes dark blood till the end of our periods.
Okay. Payal is asking that, is it okay to have too much clotting as a PCOS patient?
If you're having too much of clotting, that means you're bleeding a lot. That means you're having hormonal imbalance. So you need to actually get yourself evaluated, know that if there is any kind of hormonal imbalance which is happening, and get it corrected.
Okay. Himangi is asking why period days decrease and how can it be cured?
Why period days decrease? Okay,
Decrease.
so if your period days are decreasing, that means maybe there is some kind of hormonal imbalance which is happening. But as I said, anything which is between 2 to 7 days is absolutely normal. So if you're coming down from 5 days to 2 days is also absolutely normal. No need to worry about it. But if it has decreased drastically, like from 6 days to only 1 day, or you're bleeding half a day, then in that circumstance you need to evaluate for the hormonal imbalance.
Okay. Is it normal for your underarms to pain?
Underarms, yes, that is a part of premenstrual syndrome, and some people, they do have pain in the breast, they can have pain in the underarms, so that's absolutely normal to happen. And it happens usually 2 to 3 days before the periods and is relieved usually by the second day of the periods.
Okay. Akshata is asking what should one do when their periods are late?
So if you have missed periods, then if it is only once it has happened, then don't worry about it. But if you're missing periods very, very regularly, then you need to get evaluated for hormonal imbalance due to PCOS, or because of thyroid disorders, or because of hyperprolactinemias, and get it corrected.
If they are like delayed by a certain number of days or by a week, is there something that you can do for it to, the flow to begin or something like that?
We can definitely give you medication to get the withdrawal bleeding, because what happens is, why you are getting missed periods is because you are not ovulating on time. That is, the egg is not getting released from the ovaries on time. And when the egg is not getting released, there is deficiency of the progesterone hormone. And when that deficiency is there, so we supplement the progesterone hormone, and then we ask you to stop that hormone. So when the hormone is withdrawn, you'll get your periods again.
Okay. Akshata, I hope that answers your question. Manisha says that she's 26 and only bleeds for 3 to 4 days, with first 2 days being heavy and next 2 days being medium or light. Is it normal? Do I need to get a
Absolutely.
checkup?
No, absolutely, it's fine.
Okay. Bainal is asking, I do too have breast pain. Is it normal? I think you did answer that. It's a part of PMS, right?
So I'll just tell you that, if anybody who's suffering from breast pain, if it is before the periods and getting relieved after the periods are over, or on the second day of the periods, then it's absolutely normal. And everybody should have an habit of examining their breast by about day 9 or day 10 of their periods, because that's the time when the hormones are at their lowest limit. And that's the time when you should self-examine your breast and know your breast better, so that if there are anything abnormal which is happening in your breast, you will know that first. So that's one of the basic thing that every girl should inculcate in their day-to-day activity.
Okay. Archana is asking that she bleeds for less than 2 days. What does it signify?
So if you have scanty periods, that means there is some hormonal imbalance happening. So get evaluated for that. Maybe that hormonal imbalance, if we correct, your periods will become fine.
Okay. Everyone, if there are any more questions, please put them in the chat here. I have one more question.
Yes, please.
Why is it that PCOS patients or someone who has PCOS is more vulnerable to anxiety and depression? Like, why is it like that?
See, what happens is when there is PCOS, there are a lot of hormonal changes which are happening in the body. And there are also physical changes that are happening in the body. Like there is body dysmorphism, there is gaining of weight, there is acne, there is hair growth on the face, and whatever hair are there on the head, they keep losing. So because of that, they lose their confidence, and because of that, they're more prone for any kind of, anxiety, depression, and all those things.
So is it only because of all the external things that are happening, or is it also something that happens inside you in terms of your hormones and the chemical balance in your brain?
See, it is both. It is. Hello.
One second. Anshik, if you're there, could you just step in and see what exactly is the issue here? One
I think it's Toshi who's unmute.
Sorry? Yeah. Done.
Yeah. So it's actually both. It's body dysmorphism, and also because of the hormonal changes which are happening in the body. Both of them, they play together and, make the PCOS patient more prone for anxiety and depression.
Okay. 1 second. Manisha is asking, what is the process and test to get evaluated for hormonal imbalance? Any natural tips to fix it?
So if you want to get evaluated for the hormonal imbalance, you need to get tested on day 2 of your periods. And the usual hormones which we test are FSH, LH, prolactin, thyroid, and fasting insulin, postprandial insulin, and testosterone levels. These are the basic things which we test if somebody who has hormonal imbalance. The natural way how you can fix your hormonal imbalance is by controlling your stress, by doing a proper diet, and by doing regular exercise on day-to-day basis, and by controlling your sleep cycle, because most of us, we sleep on irregular times and we have late nights or get up late in the morning. If we control our the sleep cycle, that is, we almost sleep like about 11 o'clock and get up by 7 o'clock or 6 o'clock, and we maintain our sleep cycle, by all these things we can maintain our hormones to a larger extent.
Okay. Payal is asking, is it okay to have extra fat in one underarm? Is it something related to hormonal imbalance?
No. It's physiological. That can happen to anybody.
Okay. There's someone asking, recently while having sex, I had a pricking pain and it hurts sometimes. It never happened before. What can it be? What tests can I get done?
So it could be because of decreased lubrication also. Just see if it is constant and if it is persistent for, for a longer time. And if it does, then we need to evaluate and see that why it is happening. Once in a while is okay.
Okay. Snehal is asking, what if AMH is low? I'm so sorry, Snehal. I don't know what is the chain here. Doctor, if you know, if you can take it up from there.
So AMH is something we say that ovarian reserve. What is ovarian reserve? That is when a female is born, we are born with the particular number of eggs in our ovaries. And according to our lifestyle, the eggs get exhausted from the ovaries. So if you're a smoker, or if you're an alcoholic, or if you take a lot of oxidized food which causes oxidation in the body, then in that circumstance, the ovaries, they get exhausted of our eggs very soon. So in that scenario, the AMH is something which tells us that how much reserve do we have. A normal AMH is something which is between 2 to 4. And if you have a low AMH, that means you have a low ovarian reserve. That means you need to have pregnancy early if you desire to, or you can, keep your eggs safe, preserved for later on. Or there are certain, medications nowadays which can improve AMH to a larger extent, but still they're not very promising. And there are various therapies also which are being done, like PRP therapies and stem cell therapies, which we are doing nowadays to improve the AMH. But it's like it's a bank which has a constant amount of money, And the way it will get exhausted depends entirely upon the lifestyle.
Okay. Toshi is asking, I want to know about PCOD and I get periods after 2 months. How to cure it?
So as I've already told you that PCOS is a lifestyle disorder, what we can do to treat PCOS is to treat our lifestyle, to control our lifestyle, and to get proper evaluation. And the evaluation will be done on day 2 of your periods. Consult the gynecologist, get evaluated, know how much PCOS you have, and then accordingly see. PCOS doesn't have one treatment for one person. Every person has a different customizable treatment for them. You know, because one person might have one symptom, other person might have other symptoms. So depending upon your symptoms and your lab results, you will have a different treatment altogether. So it completely depends upon what you are presenting with.
Okay. File is asking, what is the minimum hours of sleep which is good for our health?
8 hours.
Okay. I'll give it a minute. If there are any more questions, please put them in the chat. In the meantime, I think the kind of extensive Q&A that we've had, it is again bringing me back to what I had started with in the introduction, that there are so many things that we don't know about. Like, despite reading so much, despite having so many open discussions now, but there are still so many things that we have a wrong information about, or we just are guided in a different manner, or we have been ingrained with those myths so much that we start to believe that it is true. And I think the sense of shame that we have in terms of openly talking about it, even in front of our male colleagues or male friends, with friends, I think with time that it is getting very easy. But
I think now also, if you go to a chemist shop and you buy sanitary pads, they will give you
yeah,
in a newspaper. Now
yeah,
also, like, we can't even
even
openly get our sanitary pads. It's
in
something
fact
like buying a soap.
there are a lot of women who prefer having it wrapped in a newspaper also.
Or black polythene.
Yeah, like women will be like, cover kar do bhaiya, and I'm like, why?
Why? Exactly why?
Yeah. There's one question. After how many months we can start exercise after C-section delivery?
6 weeks.
6 weeks. Okay. I think that is pretty much it. I think we have covered almost all the possible questions. If you all enjoyed this session, which was definitely very insightful for me, and I like how this was a very safe space for everyone to openly discuss about things. I mean, we do need things like this often. So you
Absolutely.
can just give us a shout out on LinkedIn at Pascare and at Noah. Apart from this, on 21st June, we will be celebrating Yoga Day, and it'll be great to have all of you joining us that day. Apart from that, we'll be sending one mail to everyone. Please share your feedback. I am sure that you will have all the good things only to say. I, though, for sure enjoyed this session a lot. And thank you, doctor. I mean, I really appreciate how you created a very safe environment. Otherwise, there are gynecologists who can be highly judgmental about a lot of things, or can be very कि मैं सही बोल रही हूँ मैं डॉक्टर हूँ. So
Absolutely, yeah.
thank you so much. There are people in
Thank you
the
for
chat
having
saying
me.
thank you.
Thank you for having me. I'm grateful.
Okay, thank you so much, guys.
Okay, bye.
Bye bye.